questions. So let's start with the basics. Monkeypox, how does it spread?
Okay, well, thank you so much for having me, Alicia, and it was so great to meet you in person. So monkeypox is a virus that's similar to smallpox. I would say it was a cousin of smallpox, and it spread through close contact. So people should know prolonged skin-to-skin contact during sexual activity, kissing or cuddling, also by touching contaminated surfaces like bedding or towels, and then through respiratory secretions as well. So those are the main ways it spreads. The public really needs to be aware of these transmission methods because, I think there's a lot of concern out there about, if I sit in a seat in a train, do I carry a risk of contracting monkeypox? Less likely, but definitely what we're seeing among the most recent outbreak is prolonged skin-to-skin contact, and specifically during sexual activity.
Okay, so about 98% of reported cases are being seen in the population, men who have sex with other men. How do you service that community? How do you message to that community without stigmatizing that community and without making everyone else believe that they have zero risk?
Right. So, Alicia, I think we have to do this in a very nuanced, thoughtful, and intentional way. I think we definitely have to engage with LGBTQ community groups and leaders regarding the messaging of the current outbreak. And so the fact is, as you said, we're seeing the majority of the cases are among men who have sex with men. And I think that we do need to make sure that we are directing those scarce resources that we have, because even though we do have vaccines and treatment for monkeypox right now, there's a scarcity of those resources. They are severely, severely limited. And so I think that we need to make sure that we are messaging specifically to that community in terms of making sure that we have access to those resources, and we do it in an equitable way. And actually what we're seeing in New York City, we're seeing Black and Latino men are being disproportionately represented. And so we know what's happened in the past. We know what happened during COVID. We know what happened during the HIV epidemic, that if we don't target towards the people who need the resources and need the medications and treatments, that those communities will suffer the most. But I think it's also important to say that, yes, monkeypox, as I mentioned, is transmitted in other ways as well, right? So it's transmitted through kissing and cuddling. And we've seen that there are children who have been in households where someone has been infected that have gotten monkeypox, but it's quite rare. So I would say right now, don't panic, but vigilance is desperately needed at this time, as well as education and public health messaging.
Well, tell me then, Dr. Blackstock, what vigilance looks like, especially because it is my understanding not everyone is eligible for this vaccine.
Right, and I would say at this point, probably not everyone should be eligible. Right now, who's eligible is people who are high risk. And high risk are people who have multiple sexual partners and are part of the men who have sex with men community. That is estimated to be about 1.7 million people. And right now, there are only about 600 vaccinations available. And also people who have had intercourse with someone who has had known infected with monkeypox. Those are the high-risk people. And then we also know that people who are immunosuppressed and people with certain skin conditions like eczema or dermatitis are also eligible for the vaccine at this time. And so we should really be making sure that those specific demographics have access to the vaccine.
Right. And so if it's not getting the vaccine, then what does it mean to be vigilant?
So what it means is making sure that providers, for example, know what monkeypox rash looks like. We've had actually multiple misdiagnoses of these rashes because even providers have not seen monkeypox before, and they don't know what it typically looks like or even atypically look like, because now we're seeing people with maybe 1 or 2 lesions. So it looks like educating providers. It also looks like educating the public about what this rash looks like and how the symptoms show up and how the disease is transmitted. So right now, I would say most important is messaging and education. We need to get that out to everyone. And we also need to make sure that we're ensuring the process to accessing treatment and vaccinations and testing is as easy as possible. We know that, and we've talked about this before, Alicia, that available is not the same thing as accessible. So we need to make sure that people know how to access treatments and vaccines when they need it.
I have about 1 minute left, but I have to ask you, a lot of talk about the rising number of polio cases in New York State. Your thoughts?
Yeah, and so I think this outbreak or these few cases actually could potentially lead to an outbreak, but I think it emphasizes the importance of childhood vaccines. So polio is one of those standard childhood immunizations that everyone should get. The community that we're seeing these polio cases in is a community that is under vaccinated, specifically to polio. And so that's why we're seeing this. Polio is a vaccine preventable illness. And I think what this case really emphasizes is that we really need to be pushing those primary vaccinations. They're so incredibly important. We know that polio has been eradicated, and now we're seeing it come back. And it's mostly because people are not getting their vaccinations, and especially children, and it's incredibly important.